Marianne, you're back. All right, good afternoon, everyone. Earlier this month, I joined Dr. Arwady in announcing our city's 5-phase Protecting Chicago reopening framework, outlining our plan to carefully reopen our businesses and public amenities while keeping our residents and communities safe from the spread of COVID-19. As I said then, moving from phase to phase would only happen if we had a clear set of criteria based on the health and science of this disease. And these include declines in case rates, having sufficient testing and contact tracing to track and limit COVID-19 spread, as well as adequate support systems for vulnerable populations, and assurances our healthcare system can handle the very real possibility of a case surge as we've seen in other parts of the country. Make no mistake, our road all the way to phase 5 will take time. Our reopening process will be like slowly turning a dimmer switch and not flipping a light switch. Yet, while our health metrics don't allow us to transition to phase 3 as we stand here today, given their trajectory over these past few weeks, I am pleased to announce that we are preparing for Chicago to take the first step in early June. All the sectors that we are announcing today need to be prepared to open. Before I provide further details on what that will look like, I want to make 2 points clear. First, like everyone else, I'm aware of Governor Pritzker's plan to lift his stay-at-home order on May 29th. And believe me, this is welcome news to all of us. However, to state the obvious, COVID-19 is not magically disappearing on May 29th. The science-based public health guidance that has informed all of our response in the last 2 months will continue to guide us until this pandemic is over. We don't have a crystal ball, but we are looking daily at the data. And I cannot give you a date certain on which our transition to phase 3 will happen. The best I can say right now is we're hoping, and we believe it will be, in early June. Now, I know that not having a date certain may be frustrating, but it's just a little more time, and I know that we can do this. But we have to be smart and careful the way we've been over these last 2 months. The second point that I want to make clear is the other part of this equation. While our current projections allow us to safely, may allow us to safely enter into phase 3 in early June, we will remain in phase 2 if those projections take a different turn. It goes without saying that I hope that won't be the case, but a lot depends upon the steps that you take between now and then. The health and safety of our residents has always been and will continue to be our singular North Star in dealing with this crisis. It's for that reason that despite many businesses and public amenities that we hope will be partially reopening in June, phase 3 still will have us wearing face coverings and physically distancing when meeting others. It will still only allow for small, non-business social gatherings of 10 or fewer. And likewise, anyone who is sick absolutely must stay home. And as will anyone who's come into contact with somebody who has COVID-19, and those who have COVID-19 symptoms have to immediately reach out to a healthcare provider. And we will also encourage our elderly residents and residents with underlying medical conditions to continue staying home. These are all really critically important parts of phase 3, phase 4, and onward until we have a vaccine. We have to be smart. We have to do the right thing, even as we start to gradually reopen. Now I'll call and ask Dr. Arwady to share some very specific details on the status of our reopening metrics. Dr. Arwady.
Thank you, Mayor. So I'll just be doing a high-level overview today. We'll be posting more details on the website, and then tomorrow at 11:30 on my Facebook Live, we'll go over all of the details in exquisite detail. So as you can see on the chart here, this really charts the metrics that we're following across the 4 main categories. Number 1, are we seeing a declining rate of new COVID cases? Number 2, do we have enough hospital capacity? Number 3, do we have enough testing capacity? And number 4, do we have enough response category? What you can see is that in each of these categories, we have made progress just since the last time that we gave an update last week. As you can see, in the declining rate of cases, we go from where you see the outline of the star is where we were previously, and then where the star is currently is where we are now. So in the case rates, the most important is that we are for the first time seeing a decline in cases here in Chicago. It's early, but it's the most important metric, and I'll show you the details in a minute. Similarly, we are seeing a decline in hospitalization and a stabilization in our ICU and our death rates, and we are seeing a significant decline in the number of people coming to the emergency department with symptoms consistent with COVID. So we are making progress in our case rate. Our hospital capacity, we were already where we needed to be last week, and we remain where we need to be for hospital capacity. Our testing capacity, we've also made good progress, moving to more advanced progress in the number of tests that we're doing and to progress in the percent positivity. And then finally, we've made some very good progress in expanding our ability to do case investigations and contact tracing. So we'll look in detail just at a couple of these high levels. First is most important, you'll note on the blue line here, we are finally seeing a decrease in our overall cases. I'll point out that all of this data actually goes back about a week. We don't use data that comes in the last week because it comes through at different times depending on when people get their test result back, when that gets reported to public health. There can sometimes be lags, and so we want to be very confident that when we see a trend is changing, that is statistically significant over a long enough time period. And so as you can see here, looking back to May 5th, we actually begin to see a decline in cases. Huge news, first time we've been able to say that. Cautious optimism. Let's move to the next slide. I also want to share the very good news that we are seeing now the beginnings of decline in all of our race and ethnic groups here in Chicago. So in the purple there, that's the Black non-Latinx group. You can see that was by far our first steep initial increase. You remember early on, a very high percentage of the cases were in the African American non-Latinx community here in Chicago. But you can see that over really more than a couple weeks now, we've been on a slow decline there. Still, though, many, many new cases. I don't want to give any inclination that we're done. The Latinx in blue here is especially in recent days where we've been very focused, been seeing a lot of new cases, continue to see a lot of new cases, but there too, we're beginning to see an early downtrend, watching that closely. Similarly, you can see in the Asian non-Latinx and the white non-Latinx groups, we're seeing a decline. But I want to be clear that we are still getting a lot of new cases. In the last 24 hours, we had 973 new cases added just here in Chicago. And so while these numbers are declining, it is slow, it is careful, and we are watching it closely. I'm hopeful that next week we'll be able to give an even better update and be very confident that we're on that decline. Next. Let's look at our hospital admission rate. So the case rate, as you know, gets affected a little bit by how much testing is being done. When we test more, we find more cases, which is part of why we look at percent positivity and make adjustments if we need to. The good thing about hospital data is that we've been testing very aggressively in hospitals from the beginning. And so we don't have to do that correction for testing. And where we see real declines in hospital admissions, we know that is reflective of of real changes in the community. And so what you can see in March there, where we were on that very steep incline, that's when we were really worried. This is exactly what New York City was looking like in terms of the steep increase. We made very good progress here. We managed to flatten the curve, if you see that, and we've been slowly watching it trend. And then finally, just in the beginning of May there, May 3rd, we started to see a statistically significant decline. And then since May 7, an even more significant decline. So again, we're keeping an eye on it, but feeling confident that we are starting to get on the other side of our peak here. You can go to the website or tune in tomorrow to see what's happening with ICU numbers and deaths. Those both lag a little bit because it takes time. Usually somebody gets diagnosed with COVID. Typically it's a week or two later when they're admitted to the hospital, even later to the ICU, and even later if unfortunately they die. So we're seeing some flattening there, but everything is trending cautiously in the right direction. Next. If we look at our testing, so we really needed and continue to need more testing capacity here in Chicago. You'll recall that we set a goal of being able to test 5% of Chicago residents every month to move to stage 3. That works out to 4,500 tests a day. And as you can see, we're now up to 4,300 tests per day. So nearly to the 4,500. As you know, the city in partnership with CORE stood up an additional testing sites, and we're standing up some more in the neighborhoods that are hardest hit to make sure that we will get to this really important goalpost. That's not our final goalpost, but that's our goalpost looking toward stage 3. So nice progress there too. And then if we look at our percent positivity, so I'll remind you, percent positivity is just the number of positive tests divided by all of the tests that have been done, counting one test per individual. And so this is about congregate settings. This is our riskiest settings. So in our long-term care facilities, nursing homes, in the jail and other correctional facilities, in our homeless shelters. If we look back to the beginning of April, we were seeing positivity rates as high as 80% initially, where we were going in. This has been a major focus of the health department. We've been working in every nursing home that has had a case, repeated surveys throughout those facilities. We're continuing to build that. We've been in the shelters doing repeat testing, continuing to work on that, working in partnership with the folks at Cook County Jail and others, really getting now down to the point where those congregate settings in particular are in good control. We'd set a goal of 30% positivity, and actually most recently we're actually at 18% positivity. So that is really good progress in our highest risk settings. And then if we look at our community settings, so again, these are not the settings I just spoke of, but all of the rest of the testing that is happening out in the community. Here, we are at 20.5% positive in our community settings. We have set a 15% goal there. And this is the one that we look at very closely to do things like drive testing to particular parts of the city, work with clinics to say, if you're still seeing more than 15% positivity, we need to drive testing up. Overall, as a city, we are at about 19% positivity, where you combine these together. But we do want to see this come down even further. This, of course, reflects the risk to average Chicagoans who are out and about in the community. And we know that there are still neighborhoods and community areas where this in particular is really high. And so we want to make sure that we are on top of the outbreaks in these community settings. You see that the decline has been very good in recent days, and I'm feeling confident, hopefully, that again, next week we will be able to give some more updated information. You can, again, come online or come and watch the Facebook Live tomorrow morning. We'll talk through each of the metrics in some more detail. But bottom line is that we are on track, but we need people to continue to stay home and save lives this weekend and next week while the stay-at-home order is in place. If you have to go out, it is very important that you continue to keep that 6-foot physical distance, that you continue to wear the cloth face coverings if you need to be within 6 foot of someone else in particular. And it's very important that you continue to do the basics of wash your hands. If you are sick at all, even a little bit sick, or you've been in contact with a known person of COVID, you must stay home, even if otherwise you would go out for essential reasons. So I am so happy to be able to share this cautious optimism that we are making real progress here in Chicago. But I'll remind you that Cook County has the most COVID cases of any county in the US. Some of that is because we're a big county. Some of it is because we've had a big outbreak. We've had to push our dates back somewhat here because of the success in flattening the curve, not seeing that huge takeoff that we were seeing in March. So this is really a sign of success, a sign of hope, and my hope is that next week we'll be able to share even better information as we look ahead. We want folks to be getting ready toward the next phase of cautiously reopening, but not to change your behavior now and this week. Thank you.
Thank you, Dr. Arwady. Indeed, there's a lot of good news in this data, but let me underscore, we have to remain diligent. Even as we enter phase 3, we will continue following the data on a daily basis, and we'll move forward or backward depending on where the data takes us. This slide that's up, you can see that phase 3 will also include making adjustments to guidelines related to capacity levels in our businesses and other areas. To help inform our phase 3 reopening, we launched a reopening survey which gathered nearly 57,000 responses from across the city. We heard that your toughest challenges were not surprisingly a lack of social interaction, which helped inform yesterday's announcement regarding mental health supports. We also heard how hopeful you are about the future, that your top priority is seeing parks open, followed by having restaurants open. We also heard creative and innovative ideas on how to go about this, which we look forward to putting into action. Now, as I mentioned earlier, we are making key progress and expect to move into phase 3 sometime in early June. But for that to become a reality, we have to stay the course to avoid the surges that we've seen elsewhere in the country. And to help us get ready, we've been working closely now for many weeks with various partners across our city, from the faith community to industry leaders, along with organized labor, in order to develop specific sector guidelines which address 2 key questions. How will you keep employees safe? And how will you keep customers and the public safe? These plans remain a work in progress, and we will unveil detailed guidelines next week. Now, assuming our metrics continue trending in the right direction, here are some of the types of businesses, industries, and recreational activities that we will expect to open with capacity limitations as we enter the first steps of phase 3. These include childcare and in-home family daycare. Childcare is a key enabler of supporting our workforce that needs to be away from home, as well as our park facilities west of Lakeshore Drive. And our libraries would serve as vital community anchors. We're also on track for opening office-based jobs, professional services, and real estate services with capacity limitations, along with hotel, lodging, and limited outdoor attractions, including non-lakefront golf courses. We'll also see the partial reopening of restaurants and coffee shops with a focus on outdoor space, as well as non-essential retail stores and personal services such as barbershops, hair and nail salons with appropriate health precautions in place. These limited reopenings will be in addition to the industries that will continue to be open or will expand operations in phase 3. And those include vital pillars of our economy, such as manufacturing, construction, and warehousing, hospitals, dentists, and federally qualified health centers, and community mental health centers, as well as public transit, regional transit, rideshare, and taxis, and public-facing city services. And yes, we do expect to open up City Hall in early June. There are also a number of sectors which we very much hope to reopen in phase 3, but which we're still developing safety guidelines and will remain closed for now. Again, this process is like turning a dimmer switch, not flipping a light switch. And these that we hope to bring online at some point in phase 3 include summer programs and youth activities, especially those at our parks, religious services, gyms, and yes, the lakefront and beaches, all hopefully later in June. We're hoping to open boating during phase 3, but congregation among boats will not be permitted. And sorry, folks, the playpen is not going to be open this summer. Now, I know everyone's anxious to see our lakefront itself reopen, but at this point, we simply aren't there yet. But we are working hard to get to that point. And when it does open, and I very much hope that it'll open sometime in phase 3, it will begin with very tight limitations on numbers, duration of use, and an emphasis on movement. Despite all these steps towards forward during phase 3, there are still a number of sectors which will, unfortunately, we expect to remain closed for the time being. These include our schools, playgrounds, bars and lounges, as well as large venues such as stadiums, theaters, music venues, convention centers will remain closed for now. We do want to see, of course, all these return, and they will, but we simply aren't ready yet for that to happen. Nonetheless, these new steps we will be taking are possible thanks to all of our residents, all of you who have remained safe and acted responsibly during these last 8 weeks. Not an easy thing to do, we all recognize. Not to mention our incredible healthcare professionals, first responders, and essential workers who have kept this city going during this very difficult time. Even so, moving into phase 3 does not mean that the crisis is over. I cannot emphasize that enough. We do not want to experience a resurgence in cases. It's not just a risk, it's a real possibility. Every place else that we've seen across the world and across the country that's opened prior to this point has seen a surge in cases. And if that surge happens, we're not going to hesitate to take the steps that are necessary, even including moving back to the restrictions that we're all now living under in phase 2. Whether or not that occurs, that surge, really depends on all of us, all of you, continuing to be safe, smart, and responsible. To help our transition to phase 3, next week we'll be providing industry-specific guidelines for all of our businesses, large and small. And these will provide clear direction on how to keep both employees and customers safe and secure during the next phase of COVID-19 crisis. We will also be making these guidelines available online so businesses can print, post, and hold each other accountable, and so the public can do the same. In preparing these guidelines, we stood up 10 sector working groups comprising more than 100 industry, labor, health, mental health, public service representatives, our faith community, and others, ranging from questions related to office and commercial real estate, education and childcare, to retail, restaurants, and much, much more, all working together to advise on how best to open our city. Furthermore, in an effort to support our local and small businesses, community-based organizations, and small not-for-profits during this transition, I'm happy to be announcing that the City of Chicago has partnered with local startup Reaply to launch a PPE market to give businesses access to purchasing face coverings, hand sanitizers, and protective barriers so they can be prepared when we cautiously reopen. All vendors in this marketplace are local, Chicago area companies, and all prices and products will be transparently posted. I know that it's going to be important for small businesses in particular to get access to these kinds of supplies that will be available on a marketplace, and we're doing everything that we can to aid you in that effort. I want to express my gratitude once again to our entire city for your commitment, dedication, and sacrifice these past few weeks. The strength and mettle of our communities has really shown through during this crisis. With that in mind, I also want to take this opportunity to give a couple shout outs. First, a shout out to the students at Muchin College Prep for being recognized by MTV and former First Lady Michelle Obama for their outstanding effort to get young people civically involved. Because of their work, they're going to be getting a unique virtual prom-a-thon experience hosted by MTV, and we're all extremely proud of them. I want to also congratulate Principal Teresita Perry of Dixon Elementary School, who today found out that she is a 2020 Golden Apple Leadership Award recipient. I had the great honor of participating in a drive-by parade to celebrate the principal, and it was a fantastic experience. So congratulations, Principal Perry and the entire school community at Dixon Elementary on the South Side. And finally, I hope you'll join me in wishing Dr. Janice Jackson, the CEO of Chicago Public Schools, a very happy birthday. And with that, I'm happy to take questions.
Mayor, thank you so much.
Sure.
I think folks, and I'm hearing, of course, from my colleagues, the number one burning question, why not a date? Why can't you say, early June can mean a lot of things to a lot of people. To me, it's June 1, but to you, is that June 10th?
No, I think the reason that we can't give a precise date is because we're focused on the public health data, and we're going to be dictated by that. So we'll certainly give people advance notice. That's why we're having this press conference today to say to folks in the industry sectors that we believe should be ready to open. We're giving them a heads up, and truthfully, we've been working for several weeks now with a lot of these various industry groups. But for those who haven't been part of the daily conversations, we want to say, here's the list. We expect these to open in early June. And we want you to start the preparations. We'll be announcing the industry guidelines early next week in preparation for being open. But I can't give you a magic date as I sit here now, as much as I would love to. We just don't know yet. You saw, as Dr. Arwady spoke, that a lot of the metrics that we put in place are all trending in the right direction, but there are some that aren't there yet. We think, she thinks, that they'll be there by early June, and we're certainly planning and expecting that that's going to happen, but I can't give you a precise date, whether it's June 1st, 2nd. I don't think it's mid-June. I think it's early June.
And when you say guidelines, does that include those capacity limits?
Yes.
That will be, the rules will be more apparent.
The rules will be very apparent. I mean, we've been spending a lot of time looking at, literally granular questions like, okay, what kind of protections do you need for your workers? Is everybody wearing masks? Or is everybody wearing gloves? What other kinds of capacity limits do you need? What are you going to be signaling to members of the public who come into your store, your restaurant, that they can feel confident and safe? And we're going to have signage that is going to be available for them. So there's actually a lot of detail and planning that has to go into opening up so that people have confidence that when they walk into a place of a business, and we're having the same kind of conversations with our faith community leaders who have been terrific to work with. People in the public want to feel safe, and there are many people who are not going to come out even as we start to reopen because they're worried about their health, and I understand that. But we wanted to be very clear the steps that we are taking and what our expectations and which we will enforce on businesses, on different sectors to protect their workers and to protect the public.
So it won't be, you will have given everyone a heads up. It won't be tomorrow, everything's opening.
No. That's why we're doing this now. My expectation is early June. Early June means to me not the 10th, something sooner than that, and hopefully in the single digits of June.
You talked yesterday about restaurants and the outdoor dining and wondered aloud whether or not, is it really feasible? What if it rains? Is it worth it? Have you had more discussions with the state, with the governor, about perhaps some indoor dining?
Yeah. So our teams have been talking. I haven't had an opportunity to talk specifically to the governor about this. There's something called Springfield that's going on right now, so we're both a little busy on that, but I intend to. I just think we've got to open up the opportunity for indoor dining with, again, some very tight controls, because these businesses are starving, and many of them will not survive unless we throw them a lifeline. And I don't think it's enough to just say outdoor dining. It's Chicago. It's going to rain. And then what? And no one can plan, and certainly not plan for have workers there and plan to buy food and all the other things that are important and take time and money and investment if it's going to be subject to the vagaries of Mother Nature. So I think that there's a way in which we can do this safely, and I look forward to continuing that discussion.
So you would prefer perhaps a 25% capacity or a 50% capacity indoor as well as outdoor?
Well, I don't want to put a number on it, because we are having a lot of robust discussions about what that should look like. But I do believe that restaurants, in order to make this economically feasible, because outdoor will help, but again, because of the weather, if we have a week like this where we have rain 3 out of 5 days, nobody's going to want to go out and dine in that. And then the restaurants, we've given them something but we are really snatching it away. So I think there's more discussion that needs to happen. I look forward to having that with the governor's team. But I want to give the restaurant industry something that's real and that they can plan for.
And Lollapalooza, is there a final answer on whether or not that will happen this
We
summer?
don't have a final answer yet. We've had a lot of discussions with them. I expect that we'll be making an announcement sometime next week about Lollapalooza and a lot of the other large outdoor festivals.
On restaurants as well, Laura Washington is asking, many of the restaurants, and you did bring some of this up, serving lower income neighborhoods on the south and west sides may not have the supplies or the cash to move to and support outside openings, the PPE, the safety barriers, all of that. What can the city do to help level the playing field so they can open and compete?
Well, I think one of the first things we've done is set up this PPE exchange, and I've got to give credit to Deputy Mayor Samir Mayakar, because this really is his thinking and really putting this into action. One of the things that we've consistently heard from businesses large and small is this constant scramble just to even get access to the basics. So we wanted to focus on Chicago local businesses that provide these materials and give an access point, because that in and of itself has been a problem. However, recognizing that, and I think Laura's point is well taken, some of these smaller micro businesses, they don't have the cash reserves to be able to make a big expense, and we know that. So we're looking at additional ways in which we can help them, and I hope that we'll be able to get there and announce publicly what we can do to support them.
Just in the last half hour or so, the president and Dr. Birx have been speaking from the White House. And from Heather Sharon, President Trump today demanded that states and cities allow churches to reopen for in-person services as essential operations, threatened to override local leaders if they did not. Will the Chicago church, will that change your rules for in-person service?
No. Look, the president said a lot of things over the last 8 weeks. Many of which he's had to walk back literally the next day or got undercut by people who were wiser than him on some of these issues. Look, the president's running for re-election. He's pandering to a base, and I think we have to recognize that virtually everything he says has a political undertone and basis for it. So look, we are working with our faith community, and just like we're working with businesses to set up very specific guidelines to help them be able to reopen safely. The faith leaders that I've talked to across the city recognize that they have to be smart about this. They're worried about their parishioners, and we get that, and so we'll have guidelines. But by no means can the president order any locality, any state, to do something that he doesn't have the power to do. And he can't do that here. So to me, it's just another thing that he said. The media pays attention to it, but we're going to be guided by the science and the data. We are not going to rush to do something so he can fulfill a campaign promise that sets people's lives at risk. He said so many dangerous and foolish things. Add this to the list.
And at the same time today, Dr. Burke said that Chicago was one of the spots, one of the cities most concerning. Almost had a different view than Dr. Arwady and saying it's a hot spot and they are concerned about Chicago.
Well, if they're saying that, as you can tell, they're not paying attention to the data.
Because you don't believe we are a hot spot.
The data speaks for itself. We've made tremendous progress because residents in the city have taken this matter seriously, taken it into their own hands, and sacrificed greatly to be able to show that we are making progress. I mean, chart after chart on every metric, we are making enormous progress. And so, what people in Washington say without looking at the data, I don't even know why someone would say something that foolish. They haven't talked to us. They haven't asked us what our data is. But if they did and they were analyzing it, they would see the same things that you see, which is that we've made tremendous progress.
And Dr. Arwady, about that positivity rate, when you spoke to it, the difference between the congregate and the community settings, if that number is not where you want it, will that hold the city back?
So it's one of the pieces that we're looking at. As you know, we've got these 4 overarching metrics. So we have to be confident cases are going down, that we have adequate hospital capacity, testing capacity, and response capacity, and it falls in that testing capacity. So it's one of sort of multiple metrics within there. I would very much like us to be at that 15% mark. I think if we're close and everything else is looking good, it's not like that piece in and of itself would completely hold us back, but I want us to be making progress toward that. I'll point out that 15% positivity is higher than what we are seeing in many other settings around the state, and in fact, really around the country. And so to that last point, the reason I think Chicago is getting some attention, it's not that we're not making progress. We are, finally. But it has been a long road, and some of that flattening of the curve that we had that kept us from looking like a New York City has pushed that date back a little bit more, where we're still seeing hundreds and hundreds of new cases every day. That's better than we were just a week or two ago, but it's one of the reasons we want to be careful as we move ahead. We want to move to this phase 3. We want to do it as soon as it is safe to do that, but we want to make sure that we do that in a way that we don't become sort of a hot spot that is not in control.
Thank you. From Univision, one of the questions on the Chicago COVID survey is, how are you feeling? Mm-hmm. Do you have preliminary results on that question, and how much does it play a role in your reopening plans?
Well, we got a range of responses from that, and I highlighted one of them. I think that people are feeling a range of emotions, as we all are. One of them was this feeling of isolation, but also hopefulness. And kind of everything in between. Not surprising. We are all complex people, and we're all experiencing this COVID-19 differently. And yes, it has the responses that we've gotten from the 57,000 people who took the time, and we have to thank them for that, but took the time to fill out the survey, have very much informed the work that we're doing. We've been sharing this out with members of the various working groups, the recovery task force. So yes, it definitely has been added value.
And Vanessa from Univision also asked, New York is doing interesting things with Yankee Stadium to bring some form of entertainment to their residents. Mm-hmm. Any plans to do something similar? Are you borrowing ideas from other cities?
I would say stay tuned. And yes, I've told my friends who are mayors across the country where I've seen things that they were doing well. I'm like, I'm just telling you right now, we're stealing that. So yeah, I mean, we're looking at a lot of different ideas, but also we have great talent here in Chicago, and they're coming up with, I think, some really innovative things to make sure that our arts and cultural life in the city remains vibrant. And some of that we are sponsoring, but I've been hearing some really interesting things that they are doing. So, for example, I think Steppenwolf Theater is going to be doing some very interesting things around podcasts. I'm stealing a little bit of their thunder, but our arts and cultural community here is as vibrant, as smart, and interesting as ever, and they are adapting to the new normal so they can provide content to showcase their talents, but also entertain the public.
John Dempsey from WLS Radio. Regarding the lakefront, numerous studies have indicated it is extremely unlikely this virus can be transmitted outside. So even if crowds of people...
That's just not true. I don't know what studies he's talking about. I think I interrupt you. Sorry. Go ahead and finish the question.
All right. Isn't the transmission risk extremely low, especially given the fact that the vast majority of Chicagoans don't have COVID-19 in the first place? Is it possible the lakefront will remain closed throughout the entire summer?
No, it will not remain closed throughout the entire summer, but let me get back to the larger point. It's just silly to say that there's no risk outside. If I am coming up to you and I don't have a mask on and I'm talking to you and I'm spitting and droplets are coming out of my mouth, you're at risk. If I come up to you and I'm talking and I don't have a mask on and I sneeze and close to you, you're at risk. And it doesn't matter if I do it inside or outside, the risk is the risk. Now, we know that the risk is reduced outside, not eliminated, but reduced simply because you're not recirculating air as happens on the inside. But to say that basically there's essentially no risk, so let's just throw the floodgates open on the outside, that's just silly. And I don't know anyone, and we spent a lot of time talking about outdoor versus indoor. I don't know any credible reports or studies that says that COVID-19 risk outside is essentially none. That's just silly.
He's also asking, Chicago has 11 golf courses, 6 operated by the Park District and 3 by Cook County. You have ordered all of them closed, even though golf is now allowed in all 50 states, including Illinois. Since golf is an outdoor activity with built-in social distancing, why not allow these courses to open? And if not, what is your timetable?
Well, I just said that golf, it would be one of the things with some restrictions that we will allow to open on courses outside of the lakefront. Look, I've said this many times. The lakefront's really complicated. The lakefront is our jewel. It's our treasure. But what we know is people flock en masse to the lakefront. So when we talk about opening up golf courses, particularly those on the lakefront, then why wouldn't we open the lakefront? And then why not the beaches? And then why not all the boating? So we're going to do this in a phased, smart way. The lakefront will open, but we have more work to do to make sure that we can open it up in a safe way. None of us want to get back to where we were in March when I closed the lakefront, where we literally had thousands of people mobbing the lakefront, all cheek to jowl. We had runners with no mask, sweating, other bodily fluid escaping. We had people out there walking their dogs, doing yoga. I mean, those are all the things that in a normal occasion, sure, but we're not in normal times. And as I said before, whether it's May 29th, whether it's June 1st or thereafter, COVID is here. It remains here. It remains deadly. And we've got to do everything we can to mitigate the risk. Opening up is not without risk. It is with risk. We expect that there's going to be some case surge, but we got to do everything that we can to minimize that from happening. And the lakefront poses a lot of complexities. It will open, but we've got to do it in a way that is smart.
Brad Edwards from WBBM TV. He says, I've spoken with a number of general practice doctors who are telling me 3 consistent things they're seeing in patients right now: weight gain, muscle atrophy, and depression. Do you believe continuing your stay-at-home order will further boy, I wish I could read that word. Will make it worse?
Yeah, exacerbate is probably
Thank
the word
you.
you meant. I hope not. And we've been saying throughout that we want people to eat well, we want them to exercise, but we want them to do it in a way that is safe. And look, this is really hard on everyone. Why we spent specific time yesterday talking about mental health supports that we want to make sure are there is because we're hearing it and we're seeing it in the data. People are struggling. So people were struggling pre-COVID, and I think COVID has layered on a level of stress and manifesting itself in depression and other things that are concerning. And so we know that that is there. We saw it in the information that we got from the surveys. So we're trying to be as responsive to the needs of people in the city as we possibly can. But I would ask folks to just think for a second. If we throw open the floodgates and take no precautions, What's worse? People seeing a surge in cases, having our healthcare system overrun? I watched last night with just horror at the mayor of Birmingham, Alabama, where literally their hospital system had one remaining ICU bed. One. I don't even know how to respond to something like that. It would be absolutely irresponsible on my part, on the part of Dr. Arwady, if we ever allowed something like that to happen in Chicago. Now, we don't control everything. We've been very clear that we've made the progress that we've made because people in this city have understood their individual responsibility. But I also know, as a leader, I've got to do the thing that is right and not the thing that is popular. Many times those two things coincide, but I'm always going to choose the thing that's right. And in this time, the thing that's right is to be guided first and foremost by the science and the data.
Brad is also asking, is there any contact tracing or any other type of proof that anyone got COVID-19 due to being outdoors on the lakefront?
Yes. Look, we do contact trace. I think he's mixing up a couple of things. Contact tracing is someone gets it, we do an investigation to figure out the sourcing. But we know from the evidence here and around the country, when you congregate, and the lakefront is an attraction where you congregate, people get sick. I mean, what else do we have to tell you? It's a fact. You want to respond to this?
I think they're looking for, have you scientific proof that you've gone back and talked to people and they said, yes, I was exercising on the lakefront, I was running along the lakefront, and now I need to tell people where I was.
Yeah, so the way that those investigations work is that we talk to people about the individuals with whom they have interacted and settings where they've been unable to keep that 6 foot of distance. So you have to make sure that there's the ability to notify people who may have potentially been contacts. So where people tell us, I've been out and about in any particular area of the city, whether that is on the lakefront, whether that is in a park, we do not have a way to identify all of the people who may have been within 6 feet of that person. And so we then cannot do contact tracing if you cannot identify who those people are. So I am not able to say with 100% certainty that there has been an individual, by definition of being at the lakefront, because the contact tracing we do is in the settings where we're able to identify individuals. But that gets to the mayor's point that why we have to be careful about situations that bring crowds together is partly because we can't do all of that contact tracing in those settings. By definition, you're bringing together potentially hundreds of people, which is some of what we were seeing. And we actually don't have a way in public health to follow up with all of those individuals. And so it's not so much a question about can we contact trace those people. It's a setting where we can't have situations like that because we can't contact trace them. And instead, we need to really, as a society, think about ways to be respectful to each other and not set up situations that unnecessarily put a lot of people in close contact with each other.
While you're there, from A.D. Quigg from Cranes, we've seen reports from other states that they are including antibody tests in their overall test numbers. Is Chicago doing that?
Absolutely not. So Chicago, every test result that we report is an individual test for whom we have an individual report. And if you look in some of the footnotes, if anybody's really interested, we go into quite a bit of detail about the testing, but we do not include any antibody testing. These are people who are diagnosed with COVID using the diagnostic test.
Thank you. From Rachel Hinton from the Sun-Times.
Before you ask the next question, let me just add one other piece regarding the lakefront. We know, without a doubt, when people gather in intimate settings, as the lakefront is, that is a breeding ground for the virus. We've seen it in Chicago, we've seen it in Illinois, we've seen it in the country, we've seen it all over the world. So, if people want to ignore the data, that's on them. I'm not going to, and neither is she.
Rachel Hinton from the Sun-Times wants to know, how did you decide which industries would be the ones allowed to reopen in early June?
We have done a lot of work with a number of consultants, obviously led by the science, and kind of done a risk analysis of what settings are the most risky and what settings are the least risky. What are the ones where we feel like, even if there's risk, and there always is, of course, that we can implement some safety precautions to really mitigate and lower the risk. So that's really where this comes from.
Last two questions, Marianne.
Okay, from Mike Flannery, as well as a couple of other folks asking about the casino. It does appear the General Assembly will not act on your request for legislation to clear the way for a Chicago casino. What now for first responders' pension funds?
I don't believe that that's accurate.
Are you looking for something today, perhaps, to
Yes.
happen? We should all listen closely?
Well, we're listening closely, so we'll see. I mean, we don't know until we don't know, until we know. But it's my impression that there is movement in the House, and we'll see if that happens.
And one, could you give us any more details of what that looks like in the House?
Well, yeah, I mean, it's no different than what we were talking about really previously, which is fixing the tax structure, lengthening the time for the reconciliation fee. There are a few other things that have been added on to assist other casinos that were approved a year ago, but have also had some difficulty getting stood up. So this is something that I think obviously provides potential benefits to Chicago, but really benefits across the state. And let's not forget that 40% of the vertical capital plan that was passed last year is dependent upon revenue from the Chicago casino. And look, what I know is this, is that our police and fire pensions are really in bad shape. The downturn in the market has dramatically impacted their portfolio, and without some substantive relief and new revenues, it's going to be very, very difficult for them to be able to survive. So my hope is that we will get some relief from Springfield in this session.
Final question from Charlie Meyerson from ChicagoPublicSquare.com. It has been more than a month since two lawyers married to one another, Leslie Ann Jones and Thomas Johnson, were murdered in their Oak Park home. And while it is an Oak Park case, he was a hearing officer for the Chicago Police Board, which you served as the president. Is his service there relevant in this investigation? Can you give us any info that you want?
It is an Oak Park case. It's not being handled by Chicago. I continue to mourn the loss of Tom Johnson and his wife, but I don't want to speculate. That investigation is very much ongoing, and I'm confident that when the Oak Park authorities believe that they have a definitive answer as to who was responsible for this heinous crime, that they will let us know.
Thank you.
Mayor, thank you.
Okay.
Everyone, thank you.
That's good? Okay, all right.
I always have more if you